Hello everyone, now let us discuss about 2023 CPT coding guidelines for maternity care and delivery. This comes under surgery, subcategory female reproductive system. And the code range that we are going to discuss now is 59,000 to 59,899. Now here we can see the various subdivisions and their code ranges that come under maternity care and delivery. The first one is antepartum and fetal invasive services, which are given by the code range 59,000 to 59,076. Next is excision. It is given in the code range 59,100, 59,100 to 59,160. The next is introduction and repair. Both are separate topics. They are given in the code range 59,200 to 59,350. Now coming to vaginal delivery, antepartum and postpartum. This is given by the code range 59,400 to 59,430. Whereas code range for Cesarean delivery is 59,510 to 59,525. Next, delivery after previous C-section. It is given by the code range 59,610 to 59,610 to 59,622. Next is abortion CPTs. They come under the code range 59,812 to 59,857. And finally, other procedures that come under the range 59,866 to 59,899. Now coming to maternity care and delivery. There are certain guidelines. The services normally provided in uncomplicated maternity cases include antepartum care, delivery and postpartum care. This is important. The services normally provided in an uncomplicated maternity case. They usually include antepartum care, delivery and postpartum care. And the pregnancy confirmation during a problem-oriented or preventive visit is not considered as a part of antepartum care. Note this point. Pregnancy confirmation during a problem-oriented or preventive visit is not considered as a part of antepartum care and should be reported using the appropriate E&M service. It can be new patient, established patient, consultation, ER visit, preventive medicine, etc. Antepartum care includes initial prenatal history and physical examination, subsequent prenatal history and physical examination, recording of weight, blood pressures, fetal heart tones, routine chemical urine analysis, and monthly visits up to 28 weeks of gestation, bi-weekly visits to 36 weeks gestation, monthly visits up to 28 weeks, then bi-weekly visits from 29 weeks to 36 weeks, and weekly visits after 36 weeks until delivery. All these things are included in the antepartum care. Any other visits or services within this time period should be coded separately. Now, delivery services include admission to the hospital, admission history and physical examination, management of uncomplicated labor, vaginal delivery with or without episiotomy and with or without forceps, or C-section. All these things are included in the delivery services. When reporting delivery only services, which are given by the CPTs 59409, 59514, 59612 and 59620, report inpatient post-delivery management and discharge services using the E&M service codes 99238 and 99239. Now coming to delivery and postpartum services, which are given by the CPTs 59610, 59515, 59614 and 622. They include delivery services and all inpatient and outpatient postpartum services. Next point is regarding the medical complications of pregnancy. For example, cardiac problems, neurological problems, diabetes, hypertension, toxemia, hyperemesis, preterm labor, premature rupture of membranes, trauma. And medical problems complicating labor and delivery management may require additional resources and may be reported separately. separately from that of the antepartum visits. Now coming to postpartum care only services, which are given by the CPT 59430, include office or other outpatient visits following vaginal or C-section delivery. Only postpartum, only antepartum services are majorly used when the patient will be under the guidance of two different physicians. In such case only we use this. But in the maternity care, delivery and postpartum services, if only one physician performs. And for surgical complications of pregnancy, for example, appendectomy, hernia, ovarian cyst, barothorine cyst, etc., see the services in the specified surgery section. And if all or part of antepartum and postpartum care is provided, except delivery, all or part of antepartum and postpartum patient care is provided except delivery due to termination of pregnancy by abortion or referral to another physician or other qualified healthcare professional for delivery, see the antepartum and postpartum care codes, which are given by 59425, 59426 and 59430. And for circumcision, for the CPTs 54150 and 54160. Now coming to first section, that is antepartum and fetal invasive services. Now coming to the first CPT, that is 59,000, 59000. It deals with amniocentesis diagnostic. Synthesis means puncture a cavity to remove fluid. Any term which ends with synthesis means cavity is being punctured to remove a fluid. And amniocentesis is a procedure performed during pregnancy to obtain amniotic fluid to test for chromosomal abnormalities and fetal infection. That is amniocentesis diagnostic. But in some cases, amniocentesis is performed in order to reduce the amniotic fluid. That is given by the CPT 59001. Therapeutic amniotic fluid reduction. Amniocentesis for therapeutic amniotic fluid reduction. It includes the ultrasound guidance. Whenever amniocentesis is performed to reduce the amniotic fluid, including the ultrasound guidance, the CPT is 59001. Now let us see an example. Mrs. Smith, gestation 1, para 0, G1P0, is diagnosed with polyhydramnios and is scheduled for amniocentesis to aspirate some of the excessive fluid. Here the excessive amniotic fluid is being removed from the amniotic sac. The amniocentesis is performed under ultrasound guidance. So the CPT is 59001. Amniocentesis, therapeutic amniotic fluid reduction, including ultrasound guidance. Coming to next CPT is 59012. It deals with choroidosynthesis, intrauterine, any method. Choroidosynthesis, also referred to as percutaneous umbilical cord, choroidosynthesis, puncture of umbilical cord, percutaneous umbilical cord blood sampling, PUBS test is a prenatal diagnostic test that can be used to determine whether there are any abnormalities present in the fetus. It consists of taking a sample of fetus blood from the umbilical cord for further testing. That is choroidosynthesis. Next CPT 59015. It deals with chorionic villus sampling, any method. The next is 59020. It deals with fetal contraction stress test. The next is 59025. Fetal non-stress test. Next CPT is 59030. Fetal scalp blood sampling. For repeat fetal scalp blood sampling, you need to use 59030 with modifier 76 and 77. The next is 59050. Fetal monitoring during labor by consulting physician. For example, non-attending physician with written report, supervision and interpretation. If the physician performs interpretation only, consulting physician, then the CPT is 59015. The next CPT is 59070. Trans-abdominal amniofusion including ultrasound guidance. Amnio-infusion. The next is 59072. Fetal umbilical cord occlusion including ultrasound guidance. The next is 59074. Fetal fluid drainage. Example, vesicosynthesis, thoracosynthesis and parasynthesis including ultrasound guidance. Vesicosynthesis means a needle is placed into the fetal bladder to remove the urine, whereas thoracosynthesis is a medical procedure to remove some fluid between the lungs and the chest wall. And parasynthesis is a procedure to drain fluid from the abdomen. So whenever vesicosynthesis or thoracosynthesis or parasynthesis is performed, including the ultrasound guidance, the CPT is 59074. Now let us see an example. Ultrasound indicate a 20-week fetus has a distended bladder and the decision is made to perform vesicosynthesis. The procedure is successful and the bladder is emptied. Here the CPT is 59074, fetal fluid drainage. Here the physician is performing vesicosynthesis, including the ultrasound guidance. Now coming to the next CPT, that is 59100. It deals with hysterotomy abdominal. Otomy means cutting into or incision. Hystero means uterus. So hysterotomy is a surgical procedure that involves making an incision. Otomy means making an incision. Making an incision into uterus to remove the uterine contents. So 59100, it deals with hysterotomy abdominal. Example for hydialidiform mole or abortion. And when tubular ligation is performed at the same site or same time as hysterotomy, use 58611 in addition to 59100. The next CPT is 59120. Surgical treatment of ectopic pregnancy, tubal or ovarian, requiring salpingectomy and or oophorectomy, abdominal or vaginal approach. Ectomy means surgical removal or excision. Salpingectomy means surgical removal of one or both fallopian tubes. Salpingo means fallopian tube. Salpingo is the root for fallopian tube. Oophorectomy means surgical removal of ovaries, which may cause infertility and menopause. Oophoro means ovary. So 59120 deals with surgical treatment of ectopic pregnancy. It can be tubal or ovarian, requiring salpingectomy and or oophorectomy, abdominal or vaginal approach. The next is 59121. Tubal or ovarian. Surgical treatment of ectopic pregnancy, tubal or ovarian without salpingectomy and or oophorectomy. The next is 59130. Surgical treatment of ectopic pregnancy, abdominal pregnancy. And CPT 59135 has been deleted. This is a deleted CPT. The next is 59136. Surgical treatment of ectopic pregnancy, interstitial, uterine pregnancy with partial resection of uterus. The next is surgical treatment of ectopic pregnancy, cervical with evacuation. The next CPT is 59150. Laparoscopic treatment of ectopic pregnancy without salpingectomy and oophorectomy. When laparoscopic treatment of ectopic pregnancy is performed with salpingectomy and or oophorectomy, the CPT is 59151. The next is 59160. Curettage postpartum. Now let us see an example. Patient presents with no menses and positive pregnancy test, but the ultrasound finds no uterine contents. Embryo has been implanted on left ovary. This is a ovarian ectopic pregnancy and this is treated with laparoscopic oophorectomy. The CPT is 59151. Laparoscopic treatment of ectopic pregnancy with salpingectomy and or oophorectomy. Here oophorectomy is performed. So the CPT is 59151. Coming to next CPT, 59200. And for intrauterine fetal transfusion, you need to use 36460. And for introduction of hypertonic solution and or prostaglandins to initiate labor, we need to refer 59850 to 59871. Under introduction, the first CPT is 59200. Insertion of cervical dilator. The next CPT is 59300. Episiotomy or vaginal repair by other than attending. Episiotomy means a surgical cut made at the opening of the vagina during the childbirth to aid a difficult delivery and to prevent rupture of tissues. That is episiotomy. So episiotomy or vaginal repair is given by the code 59300. Next 59320 is cerclage of cervix during pregnancy, vaginal. Cervical cerclage is a way of keeping your cervix closed during the pregnancy to prevent premature birth due to incompetent cervix. That is given. Next is 59325. Cerclage of cervix during pregnancy, abdominal. Previous CPT is vaginal. The next is 59350. Hysterography of ruptured uterus. Uraphy means surgical repair or to suture. Uraphy means surgical repair or suture. Hysterography means surgical repair of uterus. So hysterography of ruptured uterus is given by the CPT 59350. Now coming to next section, vaginal delivery, antepartum and postpartum care. The first CPT is 59400. Routine obstetric care including antepartum care, vaginal delivery with or without episiotomy and or forceps, and postpartum care. Both antepartum and postpartum are included in the CPT 59400. The next is 59409. This is for vaginal delivery. 59409 is vaginal delivery only with or without episiotomy and forceps. The next is 59410. Vaginal delivery including postpartum care. 59410 includes vaginal delivery including postpartum care. The next is 59412. External cephalic version with or without tocolysis. The next is 59414. Delivery of placenta, separate procedure. For antepartum care only, we need to refer 59425 and 426 or appropriate ENM codes. For 1 to 3 antepartum care visits, see the appropriate ENM codes. So for antepartum care only, the CPT is 59425, 4 to 6 visits. The CPT is 59425. If it is more than 7 visits, antepartum care is more than 7 visits, the CPT is 59426. And for 1 to 3 antepartum care visits, we need to code appropriate ENM. Next, 59430 is postpartum care only. Now let us say an example. A pregnant patient presents to hospital in active labor. The OB providing her prenatal care is contacted to perform the delivery, and the provider delivers twins. The OB will also provide the postnatal care. So here prenatal, postnatal and delivery. But the delivery is twins and it is a vaginal delivery. So the first CPT is 59400. Routine obstetric care including antepartum care, vaginal delivery with or without episiotomy and or forceps, and postpartum care for the first baby because twins are delivered. And for second baby, we will give 59409 along with 51 modifier. 51 modifier is indicated for multiple procedures. 59409 along with 51 modifier, vaginal delivery only for the second baby, because here the case is twins. Now coming to CPTs regarding the Cesarean delivery. The first CPT is 59510. Before that, for standby attendance for infant, you need to use 99360. And for low cervical C-section, we need to refer 59, 510, 515 and 525. So first CPT is 59510, routine obstetric care including antepartum care, cesarean delivery and postpartum care. And for only cesarean delivery, the CPT is 59514, 59514, 59,514. And for C-section, cesarean delivery including postpartum care, the CPT is 59515. The next CPT is 59525. This is an add-on code for subtotal or total hysterectomy after C-section. Hysterectomy means surgical removal of uterus after C-section. Listed separately in addition to the primary code because this is an add-on code, and use 59525 in conjunction with 59510, 59514, 515, 618, 620 and 622. And for extraperitoneal C-section or C-section with subtotal or total hysterectomy, we need to refer 59510, 515 and 525. Now let us see an example. 27-year-old woman delivers twins by her regular OB by C-section. Both are delivered without complication and the patient will have postpartum care in 2 weeks. Here twins are delivered both by C-section only. So the first CPT is 59510. Routine obstetric care including antepartum care, cesarean delivery and postpartum care for first baby. Next 59514. Cesarean delivery only for second baby. Along with 51 modifier to include the multiple procedures. Now let us see one more example. A 25-year-old woman delivers twins by her regular OB. The first child is delivered vaginally, but the second is delivered by C-section. Both delivered without complications. Both are delivered without complications and the patient will return in 2 weeks for postpartum visit. Here, one delivery is by vagina and other is by C-section of the twins. So the first is delivered vaginally. So the first CPT would be 59400. Routine obstetric care including antepartum care, vaginal delivery with or without episiotomy or forceps and postpartum care for the first baby. And for the second baby which has been delivered through C-section, we'll use cesarean delivery only. 59514 along with 51 modifier to indicate multiple procedures. Now coming to next session, delivery after previous C-section. So patient who had a previous cesarean delivery and now presents with an expectation of vaginal delivery are coded using the CPTs 59610 to 59622. If the patient has a successful vaginal delivery after a previous C-section, VBAC, use the codes 59610, 59614. And if the attempt is unsuccessful and another C-section delivery is carried out, then we must use the codes 59618 to 622. And to report elective C-section deliveries, the codes are 59510, 514 and 515. Now coming to first CPT 51610. Routine obstetric care including antepartum, vaginal delivery with or without episiotomy and postpartum care after previous C-section. After previous C-section, now if the patient delivers vaginally, the CPT is 59610. And for vaginal delivery only after previous C-section, the CPT is 59612. And for vaginal delivery including postpartum care after previous C-section, the CPT is 59414. The next set is 59618. Routine obstetric care including antepartum care, cesarean delivery and postpartum care following attempted vaginal delivery. Here vaginal delivery is attempted but finally C-section is only performed. Following attempted vaginal delivery after previous C-section. The next is 59620. Cesarean delivery only following attempted delivery after C-section. And finally 59622. Cesarean delivery only including postpartum care following attempted vaginal delivery after previous C-section. Now coming to abortion CPTs. Before going into CPTs, let us briefly discuss the definitions of what is missed abortion, spontaneous abortion, and an incomplete abortion. A missed abortion refers to the prolonged retention of a fetus that died in the first half of pregnancy. In other words, an empty gestational sac, blighted ovum of or fetus or fetal pole with a heartbeat prior to completion of 20 weeks 0 days gestation. It is called as missed abortion. Now coming to spontaneous abortion. It can be complete or incomplete. A spontaneous abortion that is complete any trimester and the physician manages the patient medically without any surgical intervention is termed as complete spontaneous abortion or simply complete abortion. In other words, if the products of conception, POC, products of conception are expelled without surgical or medical intervention, it is also called as miscarriage. Spontaneous abortion is also called as spontaneous. Complete abortion is also called as miscarriage. It can be further categorized as septic or non-septic. When the abortion is incomplete, when the tissue from a missed or incomplete miscarriage becomes infected, it is called as septic miscarriage. And the infection of the uterus carries a risk of spreading the infection and is of grave risk to the life of the woman. Next, coming to incomplete abortion. It occurs when the uterus is not entirely emptied of its contents. Fragments of products of conception may remain within the uterus or can be found in the vagina. Some fragments of the products of conception may have been spontaneously passed out of vagina, and a condition like this is called as incomplete abortion. Incomplete abortion simply means there are certain retained products of conception. Products of conception have been retained. That is termed as incomplete abortion. Now coming to the CPTs. For the medical treatment of spontaneous complete abortion, any trimester, use the appropriate E&M codes. That can be 99200 to 99233. And for surgical treatment of spontaneous abortion, use 59812. So the first CPT is 59812. Treatment of incomplete abortion, any trimester completed surgically. Here the physician is surgically managing or removing the contents from an incomplete abortion. The CPT is 59812. Treatment of missed abortion completed surgically first trimester. The CPT is 59820. And the treatment of missed abortion completed surgically second trimester, the CPT is 59821. The next is treatment of septic abortion completed surgically. The CPT is 59830. And induced abortion by dilation and curettage, DNC. The CPT is 59840. And for induced abortion by dilation and evacuation, the CPT is 59841. And next is 59850. Induced abortion by one or more intra-amniotic injections, including hospital admission and visits, delivery of fetus and second innings. Next CPT is 59851. Induced abortion by one or more intra-amniotic injections with the dilation and curettage and or evacuation. Next is also continuation 59852. When the induced abortion by one or more intra-amniotic injections, including hospital admission and visits, with hysterotomy due to failed intra-amniotic injection. The CPT is 59852. The next CPT is 59855. Induced abortion by one or more vaginal suppositories with or without cervical dilation, including hospital admission and visits and delivery of fetus. The next CPT is 59850. Here, induced abortion by one or more vaginal suppositories with dilation and curettage and or evacuation. The next is 59857. Induced abortion by one or more vaginal suppositories by hysterotomy due to failed medical evacuation. The CPT is 59857. Now coming to other procedures. The first CPT is 59866. Multi-fetal pregnancy reduction MPR. The next CPT is 59870. Uterine evacuation and curettage for hydalidiform mole. The next is 59871. Removal of cerclage suture under anesthesia other than local. The next CPT is 59897. Unlisted fetal invasive procedure including ultrasound guidance when performed. The next is 59898. Unlisted laparoscopy procedure, maternity care and delivery. The next is 59899. The final CPT. Unlisted procedures, maternity care and delivery. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.